am Dr. Richi Gupta. I am Director and Head, Department of Plastic Surgery at Fortis Hospital, Shalimar Bagh, Delhi, India. In plastic surgery, we do a lot of what is known as gender affirmation surgeries. Now, what is gender affirmation? Basically, a person has two attributes to him. One is sex and other is gender. Now, sex is what we are seen at birth. The parents see us, the doctors see us, and they say that a male or a female baby is born. That is the sex of the patient. And what is the gender? Gender is what our mind says. Mind perceives us to be. What our inner sense or self says that we are a male or a female. Now, normally these two are in alignment with each other, and hence we are cisgender. We are considered normal. But sometimes these are not in alignment. A person who is born with a particular sex doesn't feel that he is born like that. He feels like a male trapped in a female body or a female trapped in a male body. Now, this is a real condition. It's not just what patient has thought of, and science has proved that it exists. Today, medical evidence is there that this is a real condition. Now, what patient perceives is patient's brain. It cannot be changed. It remains the same forever. But what patient's body is, we can change. Hence, we can change the sex of the person to bring it into alignment with the patient's gender. And these surgeries are known as sex change surgeries. Gender can never be changed because gender is brain. Hence, however, gender can be affirmed by bringing the patient's sex into alignment with the gender. Female to male surgeries consist of three different operations. One is a top surgery, where breast part is removed and reduced so that a person can wear a t-shirt and appear like a male in the society. The second surgery that is carried out is removal of female internal organs like uterus, ovaries, vagina, fallopian tubes, etc. And the third operation is construction of male organs like the penis, scrotum and urethra. Male to female patient usually undergoes two different operations. One is augmentation of the breast. This is done with the help of silicone gel implants. And second is what is called a feminizing genitoplasty, where the male organs are removed and female organs are created. Normally, vagina is created by two different methods. One is the inversion of penile skin called penile inversion vaginoplasty, and the other is by using a segment of large intestine called the sigmoid colon, and then it is called as sigmoid vaginoplasty. Besides these main operations, other operations can also be done, and these are like facial feminization surgery for feminizing the face, voice change surgery where voice can be feminized or masculinized. Now, in this center at Fortis Hospital, Shalimar Bagh, we perform the largest number of such operations in India. I personally have an experience of around 3,000 such patients in past 27 years. We do both male to female surgeries as well as female to male surgeries. Now, I have seen since I started practice 27 years ago that the number of such patients is rising. Initially, only 5 to 6 patients used to come per year, but today we are receiving 150 such patients every year and performing 242 such operations we did in 2019 alone. And this is not only my experience, this is the experience of other gender affirming team all over the world. Amsterdam VUMC published a paper in which they recorded a 20-time increase in the number of such patients. And if we look at recent world literature, we find that the number of such patients has increased considerably. 20 years ago, the incidence quoted was one such patient in 1 lakh population. But today, the majority of data suggests that there are 0.4 to 1.3% of population may be transgender, which translates to nearly 1,000 transgender persons per lakh population. So you are not alone, your condition can be corrected and your gender can be affirmed by going to a registered and correct place where we can perform the surgery. As per the World Professional Association for Transgender Health and also the Indian Professional Association, gender surgery is no more a taboo. The expression of gender is no more a taboo. The gender expression is very variable. Today, no male or female can be said to be 100% male or female. Gender is a spectrum and hence it must be respected. These patients should not be subjected to ridicule or a minority stress.